Vaccinated? You must do this to protect yourself from Delta. COVID-19 vaccines light the hope of returning to normal. But that changed when the Delta variant emerged. Now, it is increasing the number of new cases, hospitalizations, and deaths across the US. Still, getting vaccinated is better than without because you are less likely to develop severe disease. Of course, vaccines cannot stop COVID-19 alone. According to a new study published in Scientific Reports, researchers examined how vaccine-resistant variants came to be. They explored what factors may have a bigger role in the emergence of new variants. They created an SIR-derived model and analyzed those factors. Among factors, the two with the biggest influence were vaccination rate and non-drug intervention. The vaccination rate shows how many people have been vaccinated against COVID-19. Non-drug intervention means any methods not involving medicines. Face masks, physical distancing, and hand washing are examples of this intervention type. Against the fast-spreading Delta variant, communities would require both vaccines and non-drug intervention. If there are more people vaccinated, why maintain non-drug intervention? This is because lifting restrictions in vaccinated populations may urge the prevalence of more vaccine-resistant variants. When most people are vaccinated, the vaccine-resistant strain has an advantage over the original strain, said Simon Rella of the Institute of Science and Technology Austria per CNN. Rella explained a vaccine-resistant strain spreads faster in a community when most people have been vaccinated. It is more difficult to control when people start doing things as if everything is back to normal. But what they don't know is the resistant strain still spreads and may even endanger those who aren't vaccinated. Like bacterial diseases, one possible counter to resistance is not to use drug-based interventions as mitigation. Thus, researchers urge lawmakers to maintain the use of face masks and physical distancing. Keep the restrictions in appropriate cases to limit the spread of vaccine-resistant strains and reduce the risk of new variants emerging. These simple methods can be significant in restricting new mutations. On July 27, the CDC updated its guidance for fully vaccinated people. The agency now recommends everyone to wear face masks in indoor public settings in areas with high transmission rates. For those who are confused, wearing face masks in these settings, despite being vaccinated, is meant to control the spread of vaccine-resistant strains.